Good day, my name is Carbonilla and I will be doing the Perineal Care and the Peri-light checklist. Now before proceeding to the procedure, what we're going to have to be doing is we're going to be collecting the materials needed for this checklist or procedure. What we're going to be doing before we proceed with the procedures is we're going to have to prepare the client. By preparing the client, we're going to be informing the client what we are going to be doing to her, which is perineal care and the Peri-light. And from there, we're going to have to provide the client the privacy that she needs. We have to drape her down. After draping her down, we should also provide an extra pillow up her head. As you can see, we put an extra pillow as my makeshift client. After providing an extra pillow, we're gonna have to offer a bedpan. This is my makeshift bedpan at the moment because I don't have the real one, but let's assume that this is a bigger, a deeper, legit bedpan. We're gonna offer it to the client. Now, what we're gonna be doing is we're gonna be doing the RIDA assessment. What is the RIDA assessment? Now we're gonna do this. We're gonna have to check on the client's perineal area, and from there, while doing this, we should always remember to provide privacy. So as you can see, now we're going to be performing the RIDA assessment, which is the redness. We're going to be checking for redness, edema, ecchymosis, and we're going to check if there's discharge, at the same time approximation. Now after assessing the RIDA, what we're going to be doing is we're going to be preparing the materials needed in the bedside. As you can see, materials that we're going to be using. And we are going to start the procedure. Now to start off perineal care, what we should always do is we should always perform the proper hand hygiene. The purpose of this is to prevent cross infections. Now after washing your hand, what we should do is prepare and should spread the draw sheet. Now when preparing the draw sheet, what we should do is we should insert it just underneath the perineal area. Well, you see, the purpose for this is to avoid bed staining. You should always assist the client to her hips. You should always remember that. Oh. At the same time, you should always give the client comfort, and as well as the privacy. So after spreading the bed sheet, draw sheet, we should ask the client to maintain a dorsal recumbent position. The purpose of this is it's for proper access when cleaning the perineum area. So the client will be laying. After that, we're gonna have to wear our gloves, and we're gonna start wearing our gloves. Ta-da! Now the purpose for wearing gloves is to prevent cross-contamination again. Now from that, we're gonna have to get our bedpan. This is my makeshift bedpan. So what we're gonna be doing is we're gonna be putting this in between the client's buttocks. Again, assist to the hip area. There you go. So the purpose for the bedpan is to help wash off the collect the water that we're going to be using to wash off the perineum. The next is we're going to be pouring water in the genital area. The purpose of this is to flush away if there's any a vaginal discharge, such as lochia or whatever. So after pouring water over the genital area, what we're going to be doing is we're going to be getting a cotton ball, a sterile cotton ball, and we're with betadine solution. Now, the purpose for this is to prevent the entrance of bacteria from the colon into the urinary tract. Now, what we're going to be using to hold the bottom is forceps. So, the purpose of this is to prevent contamination. Now, here is how we're going to be starting the perineal cleaning. And here is how we're going to be cleaning the genital area. Now, before starting, we're going to have to follow the procedure stroke of 7. Now, from doing this, we should always start with from the pubis area. This is the first part. 1. And from there we dispose. From there we dispose that. Get another cotton ball. Next is we're gonna clean the thigh, inward to outward, like this. Then after that we dispose. Next is the other thigh. Prepare that. Inward to outward again. Dispose. And this is where we start cleaning the genital area. First, we're going to start with the labia majora, the outer area, which is this side first. After that, dispose. Okay, after that, dispose. Next is, what we're going to be cleaning is the labia minora. Okay. Dispose. After that, dispose that. Next is we're going to be cleaning the vaginal orifice. Okay. From the up area, downward. Dispose. And from there, we're going to be cleaning the anus thoroughly to the anus. Dispose. After cleaning the genital area, what we're going to be doing is we're going to be removing the bedpan. But by removing the bedpan, we should always support the client to her hips. You should always remember that. Okay, now when removing the bedpan, we're going to have to request the client to move on her side because we are going to be cleaning the liquid on her buttocks. So let's assume that the client turned sidewards. I can't really move this since it'll be difficult, and it might get my makeshift mom might get destroyed. But let's assume that she's on her sideline position, and we clean off the butt and any wet parts, especially from the bedpan. We're gonna have to assist with that. Now, as we're done, and now for the next checklist, which is the infrared Peri-light procedure. Now, for the next procedure, what we're going to be using is the infrared or the Peri-light procedure. As you can see, this is my makeshift Peri-light procedure. My make UV light or Peri-light. And here's how it goes. And for the first procedure in this in the perineal infrared checklist, what we're going to be doing is we're going to have to be spreading the bed sheet. The spreadsheet. Purpose of this is to avoid any soiling of the bed sheets or avoid staining the bed sheets. Next is what we're going to be doing is we're going to have to request the client to remain in the dorsal position. The purpose for remaining the dorsal position is it's because it is more accessible for the perineum area. Next is, again, we're gonna be wearing our gloves. Setting up a new pair would be preferable, especially if it's sterilized. Now, what we're gonna be doing is we're gonna be applying betadine to the episiostomy area. Usually, it's cut around here, just beneath the vaginal area to the anal area. Now, what we're gonna be doing is we're gonna be getting, once again, the cotton. This instrument. Let's assume this is covered in betadine. So what we're going to be doing is we're going to be applying the betadine solution to the episiostomy site, as seen here. After applying betadine, dispose of the cotton. What we're going to be doing is we're going to be exposing the vaginal area to the UV light, as you can see here, for around 10 to 15 minutes. The purpose of this is to fasten the healing process, and at the same time we're gonna have to make sure that the UV light is at about 18 inches to 24 inches away from the perineal area. This is my makeshift, so don't mind that. So what we're gonna do is we're gonna be starting the UV light treatment for around 15 to 20 minutes. After 15 to 30 minutes, we turn off the UV light, and we should always remember, I forgot to explain this, was we should make sure that the distance should be at around once again 24 inches to 24 inches. It's to avoid a burning of the perineal area. That was just one thing I forgot to say. So after that, what we're going to be doing is we're going to have to be removing the Peri-light. After removing the Peri-light, we are going to be recording. We are going to be recording the procedure. We're going to record it. We're going to be putting the time, the time the observation was made. Next is the procedure that we did. At the same time, we should also remember putting on the date. Now, after that, what we could do is so now what we're going to next is what we're going to be performing is the aftercare. Now, aftercare is we could change the linen if necessary. Now, what we're going to be doing is we're going to be removing this. We're going to be removing everything that we use. Let's say this. We're going to dispose of it. We disposed of used gloves, used cotton, and anything that's used. After that, we're going to have to give a client again her privacy. And from there, we're going to have to wash hands. And once again, we're going to record everything that we have done during this procedure.